So I joke with my friends who call themselves comprehensive dentists, but haven't gotten the airway training. And I tease them and tell them that you're not a comprehensive dentist if you don't also screen for airway. And I say that joking because I also was a comprehensive dentist 5 years ago and was very proud of that. But until I started learning about airway, I realized that everything else that I was learning and telling my patients about did not all fit together if you're missing that airway component. Airway is everything, and everything in our mouth is affected by our breathing. You can't be a comprehensive dentist and you can't treat your patient comprehensively if you're not evaluating their airway and realizing how that all comes into place. As a Dawson-trained general dentist, I've taken hours and hours of courses about TMJ issues, TMJ disorder, grinding teeth, tooth wear, and jaw pain. It was the Dawson Academy that brought airway into my life. Now, every TMJ patient that comes into my practice is an airway patient. The reason most of the time why their TMJs are breaking down or causing muscle discomfort or joint discomfort is because they're not breathing well at night. We all know that most of the grinding, the teeth clenching, most of it is at night. When I start looking at my patients differently and realizing that their airways are compromised, creating them to clench and grind their teeth because they're trying to keep their airway open, that's the why. That's why their teeth are being broken down. If we just put a bite slit in their mouth and cover their teeth with plastic, we're not solving the problem. How did they get where they are? Most of my TMJ patients, they come to me, they have narrow arches, they have small airways, they may have a deviated septum and an inability to breathe through their nose. We need to dive deeper, and it's changed everything that I do. Every single one of my new patient exams turns into an airway consult and an airway discussion. We're going to talk about how airway symptoms present for adults. What we see when we have a narrow airway is that they're more prone to airway issues such as snoring and sleep apnea, but they also may present with high blood pressure, gastric reflux, narrow jaws, crowded teeth, and worn down teeth. We need to look at the full picture for the adults and find out how they got where they got to. It always leads me to think about the child that they once were. When they're an adult, there's still things that we can do. We work on expansive orthodontics for adults, such as Invisalign, removable expanders. Our goal is to make more room for the tongue. The tongue can come forward and out of the airway, and that patient can breathe better. We do CT imaging and make sure that they don't have physical anatomical limitations to nasal breathing. Some people have nasal septums that are deviated and they physically can't breathe through their nose. Others might have a chronic sinusitis, which is causing congestion, or tonsils and adenoids that are swollen, primarily in children, that are causing a physical barrier to breathe through your nose. We want to make sure, can they breathe through their nose? And if they can, then we know it's a habit that has formed and we need to break that habit. So we have myofunctional therapy for children and adults. I work with a great team of girls at MyoAir that help both my children and my adults get that tongue up where it should be, get them breathing through their nose, and break that habit. And I always say our tongue is our forever retainer. So if our tongue is sitting properly, we have a much less chance of having orthodontic relapse as well, because the tongue is going to keep the teeth where they should be. The difference between conventional orthodontics and airway-focused orthodontics is we use the same tools. So we're going to be using Invisalign, we're going to be using brackets, expanders, all the same things that any orthodontist is going to do. But instead of a tooth-focused treatment plan, it's going to be a jaw-focused, a bone-focused, and a muscle-focused. Relatively healthy 50-year-old man came in for a basic checkup at a conventional dental office that isn't trained in airway. He would be a quick exam, hygiene, and 2 cavities, and that would be it. But I ended up talking to him for about an hour about his sleep. The reason why is because he had acid erosion on his teeth and cavities on those areas of acid erosion. So it would have been very easy just to say, you have a couple fillings, let's treat them. But we always need to look at the why. So then we start looking back and I said, did you know you have acid erosion on your teeth? Do you have reflux? He said, well, I used to have reflux. I'm like, okay, Do you snore? I said, yeah, I do snore a little bit. And then how's your blood pressure? Oh yes, well it is elevated. So then we start painting the picture and the patient's like, how do you know all of this? And then we pull up their CT scan. And this patient, no surprise, had an extremely small and underdeveloped airway on the CT scan. So then we're painting the whole picture for this adult on why are those teeth worn down and why do we need a filling? I would be doing a disservice to my patient if I only filled that tooth and didn't find out why that happened to begin with, because it's just gonna happen again. So then we start saying that we need to do a sleep study. We need to know how they're sleeping at night, and lo and behold, it comes back positive for sleep apnea. We get the apnea treated through a wide variety of treatment options, and then the reflux goes away, the blood pressure gets better, and they're not gonna need another filling on that tooth. The more I do this, the more I'm blessed that I get to see many patients every day for sleep consults. And for me, a sleep consult and an ortho consult go hand in hand. So when I see a patient, we're looking at their bite, we're looking at their habits, we're looking at their sleep, and we're looking at their anatomy. Once you start researching airway, you'll find so much information online as well as in books. So I've listed some helpful information in the descriptions that gives you some websites that you could do some self-evaluation, as well as some books that I love that talk about this. Please follow me and watch more of my videos.